Hey everybody, welcome to the pain series. We're going to talk about lower back pain today. We're going to talk about common causes and common diagnoses, symptoms, therapies, and self-care. We are the FitHealth Pros. I am Coach Sean.
I'm Dr. Kevin.
We're going to talk about lower back pain today. It's a very common complaint amongst primary care physicians. Some lists have it as high as number 2 on the overall list. On some other periodicals have stated that up to 85% of us in the U.S. Either have had or will have episodes of lower back pain sometime in our life. Now generally these episodes will resolve in 2 to 4 weeks, either on their own or with the help of some providers. The most common ages, again, when dealing with lists, some lists say anywhere from 40 to 60 are the most common ages to have it, others from 35 to 55, but it can also present much younger than that as well, depending on certain activities and or degradation of the back itself. I'm going to give you a little definition of what lower back pain is. It's generally related to problems with the lumbar spine, the discs between the vertebrae, the ligaments around the spinal discs, the spinal cord itself, and the nerves, muscles of the lower back, the internal organs of the abdomen, and or the skin covering the lower lumbar area. So it covers quite a bit. So first off, we're going to have Dr. Fox here talk about common causes of lower back pain and common diagnoses.
Right. So based on that definition, you can see that there can be a lot of areas that can be symptomatic, but what we want to do is try to find out, where is this coming from? What's the true cause? So what we see a lot of times in my office, there's going to be pretty much 2 different types of presentation. So either someone's going to have this back pain for quite some time, where it's going to be more chronic over time, or they're going to have it where it's going to be an acute type of pain. Sure. And we've talked about chronic pains and acute pains in our other videos, so if you want those definitions, definitely check those out. But from an acute standpoint, so that's going to be where someone's coming in, accident, like an auto accident, a slip or a fall, a work injury, a sports injury. Those are the things where someone's doing something where they may be misusing their back, or they're getting a little overzealous with that, improper lifting techniques. All of those type of things are an injury that's going to be more short term, and so we look at that as a acute cause. Now the chronic conditions, that's going to be, again, like Coach Sean had mentioned, the degradation of the spine and those ligaments and those tendons. As we get older, they start to change. The physiology starts to change there. We may have lack of hydration. The disc actually loses the plumpness of the kind of the squishiness of the disc. So it's like a jelly donut. So the inside of the jelly, that nucleus of the disc, starts to deteriorate. And that's where, when I take x-rays and we review those with the patients, we'll start to see where the vertebrae start to get closer and closer and closer, and we find things now where we get into that diagnosis, where when you go to the orthopedic doctor or you go to the urgent care or ER and they put your x-rays up after you've hurt your back, and they may say, okay, well, you have a compression fracture, or you have spinal stenosis, you have degenerative disc disease. A disc bulge, you can't see that on x-ray. That does require an MRI. Same thing with the disc herniation. And I'll throw one other little tidbit in there, because a lot of people like to
Tidbits.
I
like tidbits.
They'll say, oh, I slipped my disc. Well, there's no such thing as that, unfortunately, or fortunately. It's usually just the disc bulge. The discs are really attached to the vertebra, and they're in between the vertebrae, so they're really attached really good to the top and the bottom of those vertebrae. So it can't slip, but it can bulge, it can herniate. We're going to see that on the MRI, but we can also do some testing to give us an idea if someone may have a disc injury or a disc bulge. Osteoarthritis, I said the degenerative disc disease, there's another thing called degenerative joint disease, DJD, which is the same as the osteoarthritis. So that's going to appear that the bones are more kind of bumpy. They may have a bone spur. There's different phases of degeneration as well. So it's good to take an x-ray, maybe not if it's an acute injury right away, because you may have a presentation where you're leaning away from that pain. But after things have settled down, if it's been chronic, you definitely want to get an x-ray. So those are really the common causes and the common diagnoses.
Very cool. So I'm gonna jump right into symptoms. Kind of what you may be feeling when you're dealing with a bout of lower back pain. It could be dull and achy. It could be stinging or burning down the leg, like in, say, a sciatic episode. Spasms with muscle tightness in the low back, pelvis, or the hips. I've actually had a client who would end up on the floor multiple times a month due to stress from work, where the spasms would just kind of take over. There could be a worsening with sitting or standing over a prolonged amount of time. You could have difficulty standing up straight anyways, just because that pain is so intense. And or walking. You could be having issues where you can't even walk. You see people sometimes where they're just hunched over and walking like that, especially as the spine starts degrading over time. That lower back pain is keeping them from standing up to a decent posture, to a correct posture. Now, if folks are not getting the help that they need, and it becomes very chronic and very severe, you could end up with weakness in the legs, loss of bladder control, intense stomach pain, or a high fever. So if this happens, please get immediate medical attention. Preferably get help before it gets to that point, of course. Lots of providers out there that can really help you along so you don't get to that point. But if it does get that severe, please call somebody immediately.
Absolutely. Yeah, so even if you started therapy, if any of the therapy you get those type of symptoms, seek medical attention.
Yes.
So that kind of brings us to the different types of therapies that can be provided to improve the back pain, decrease the back pain, even prevent the back pain. So number one is if you just had a strain or a sprain that's recent, I'm going to even say, as a chiropractor, you want to stay home and just self-treat with some ice, or just kind of monitor that for the first couple of days. You don't need to rush in and get a bunch of physical therapy the day that you feel a little strain or sprain in your back. Now, if you do want to think about this though, if it is bad enough, the reason you want to seek care even when you're in pain is because you want to be put in a healing position instead of having your body do it. And what that means is if you just sit around and you let your body do it, there's going to be scar tissue. Your body's going to compensate, which may put stress on different areas.
Cause a different injury.
Right, and cause a different injury. Mm-hmm. I can give you an example. If you have hip pain or sciatic pain and you try to work through it, you're going to maybe get knee pain down the road. I've seen that happen many, many times.
Yep.
So a lot of people are afraid or they're scared to go to a chiropractor or physical therapy or get a massage because of they're in pain already, which is funny because a lot of times they'll not go because they think it's going to cause some pain. But really, there's different techniques within all realms of care. So PTs have gentle techniques and they have more aggressive techniques. Massage therapists have gentle techniques and they have deeper tissue techniques. Even the medical doctors have more invasive techniques and basic techniques. So as a chiropractor, I just want to let you know that the same thing applies. There's gentle techniques like instrument adjusting, stretching, and then there's more of the manual manipulation, which still can be pretty gentle, but if you compare, that's going to be a higher force type of technique. Now there's traction and instrument adjusting, like I had said. There's trigger point work, whether it's manually or through injections. Physical therapy goes into rehabbing and balancing those muscles that may have gone out. Stretching. The massage therapy is going to get into myofascial release and back to trigger point therapy. Our massage therapists can do stretching as well. On the medical side, and I'll say we want to include everything, but just make sure that you're understanding what phase of care. You want to do your conservative care first, and then surgeries and medical last. So there are epidural steroid injections. So you do need to get an MRI to see if you qualify for that. But if you're not getting better through the chiropractor, through the physical therapist, or through training exercises, that may be the next step. I don't love the steroid part of it. There's what's called facet injections that can be done with non-steroid components as well. And then there's the pain medications. So it used to be if you're in pain and you went to the medical doctor, they would give you a muscle relaxer and usually an opioid type of pain relief. And now we know that's not the preferred range. Now, speaking of pain medications, ibuprofen, Tylenol, those are non-steroid anti-inflammatories. Just be careful if you don't ever take them, and you take a couple 100 milligrams or even 800 milligrams, you're okay for a couple of days. But if you're a person that has a headache or muscle pain and you play tennis or you're just always achy and you're taking 400 milligrams of ibuprofen every day for the last 5 years, I don't encourage that. Be careful, because you can really, it can be very problematic. Last resort, spinal surgery. Look at the intensity of the pain. That's where you're consulting somebody, and usually there's going to be a disease, possible herniation, bone spur, the disc can fragment. The very worst case scenarios are going to be surgery related. There's so many other ways to take care of 99% of the problems. So just look at those conservative things first and surgeries last.
That's a lot.
Yeah.
This is why we do these videos, to educate, to help you along. Lastly here, I want to talk about self-care. Things you can do at home, either on your own or after or during therapy sessions. After you come home, you're going to be able to exercise the core a little bit. That'll take some of that pressure off the lower back. The core is meant. Now the core does wrap all the way around the back. It's not just the rectus abdominis in the front here. We need to get the core strong so that it takes a lot of that pressure of activity away from the lower back. In doing these light exercises, you can also help release endorphins. These endorphins will help release anxiety and stress and depression that could come along with the mental side effects that come along with lower back pain. You're going to want a light stretching, especially the hamstrings. Again, the hamstrings can tighten up as the lower back pain starts to present, or it can get tight in the first place and then the lower back pain starts to present. So you've got to make sure that those hamstrings are stretched regularly. Restorative sleep is also something very important. Let the body heal itself. Our body heals the best during our sleep times, during deeper sleep, restorative sleep. Like Dr. Fox had said earlier, heat and cold. Get that blood flow going throughout the area take the inflammation down as well as you can, preferably with non-pharmaceutical means if you can. That's where that ice especially comes in. Meditation, and something else I found that I thought was interesting is don't stop doing joyful activities. Oftentimes when we're in chronic pain like that, we take ourselves out of the ball game. We take ourselves out of those times where we can actually find joy. When we can find joy, that can take our mind off of the pain as well. Speaking of a nutritional side of things here, we can kind of go toward more of the anti-inflammatory foods, such as tuna or salmon, sweet potatoes, red wine, nuts, olive oil, green tea, basil, cinnamon, and the one spice that everybody's kind of gaga over right now that's kind of the most popular is turmeric as kind of the miracle anti-inflammatory spice. Right. There are a lot of ways that you can do self-care. You can also use foam rolling as well. I use that with a lot of my rehabilitative fitness clients that have sciatic issues, getting in the glutes, getting in the IT bands, trying to loosen up the areas when the body goes into a protective mode from this pain.
Right. Very good. Well, hopefully that was a good roundabout education for you guys. We're going to go ahead and we'll put the board up in a link below. It'll be in the description. The other thing what we would like to do is ask you guys to comment on this. This is a low back kind of an educational video in our pain series, but we would like to do more videos and get very specific in what treatments that you guys would like help with. So if you can comment, leave if you're male or female and your age, what kind of low back pains are you having, and give us an idea of maybe what the cause was, and we can give you some ideas on stretches and some exercises and some nutritional things that you guys can do at home to help heal that. We're going to be doing those videos anyway, but sometimes someone might say something that we didn't think about.
Might stoke the coals of our creativity.
Right. Absolutely, we're going to cover traditional back pain that would come across from maybe a lifting injury or a sports injury. Sciatic pain is really
a
hot one.
For sure.
And then you go into things like neuropathies, trickling down into the extremities, hip pain, knee pain, foot and ankle pain, things like that. So we'll go into those as well, but give us a shout out if you like this. Definitely subscribe to the channel.
Smash the subscribe button.
Don't hurt yourself. Don't get back pain.
Don't hurt your thumb.
Don't hurt your thumb. We'll have thumb massage techniques.
That's coming up.
Video.
It's coming up. It'll be one of our top videos.
Yeah, top 1,000.
100,000.
100,000. But the other thing is sign up for the notices, because we'll keep adding things here.
Yep.
Again,
like the video and subscribe to the series.
Right.
We'd love to help you.
So keep an eye out for that. We are the FitHealth Pros, and I'm Dr. Kevin.
I'm Coach Sean.
And thanks for watching.
Thanks for stopping by.
Oh, my aching back.
No Jacksons were injured during the making of this video.
How's your back?
Pretty good.
Pretty good.
Pretty good.
See?
Did you put some ice on it?
A little bit.
A little bit? All right.
Okay.
Give me a thumbs up.
Triple thumbs up.
Yeah. We're the FitHealth Pros. You want to say it?
Oh, yeah.
FitHealth Pros.
FitHealth Pros.
Coach Sean.
Dr. Kevin.
And?
We are the FitHealth Pros.
And Jackson.
And Jackson.
Thanks, everybody.
Thank you.